You know, I'm guessing that when you were in your teenage years, you might have had an outbreak of acne or two, but didn't you always figure it would go away once you were an adult? There are times I've got more zits than my teenage boys. Dr. Jepson is with the Utah Dermatologic and Medical Procedures Clinic and says there are different reasons you get acne when you're adult and obviously different ways to treat it. So why, when we're older, don't we outgrow that? We still keep having problems, right?
Well, that's what I thought until I started seeing a lot of adults for skin problems, and adult after adult, women especially, come in still complain of acne. Sometimes they didn't have it when they were kids and when they were teenagers, and now they have it all of a sudden. And there's a couple of reasons. We're going to talk about them, but the first one is that as we get older, and especially as women get older, they put more stuff on their face. There's more expensive cleansers, more expensive moisturizers, more expensive makeups, and what that does is cumulatively just clogs their pores. Clogged pores cause acne.
Yeah, we tend to think as we're putting that stuff on our face, it's actually helping our skin, but actually it can be causing problems.
Right.
But one of the things I didn't realize, when I'm like thinking of washing my face, I get in there and just scrub and, you know, get all that stuff off. Is that actually bad?
That's actually bad. There's a couple of really easy conservative things that people don't think about that can help clear their face. Scrubbing your face releases more oil into your skin and clogs your pores. What you want to do is just gently rub a good doctor-grade cleanser onto your skin. Makes a huge difference in terms of keeping your pores clean.
Number one tip, as you mentioned, use the right kind of cleanser. Find the right kind of cleanser.
The cleansers play a huge role, and you know, most over-the-counter cleansers for acne really don't do a very good job, and so that's why a lot of people, they'll go to the store, they'll buy a bunch of stuff for their acne, and they'll still break out. You want to use a doctor-grade cleanser, pure ingredients, more active ingredients that can actually penetrate and clean. And we have a brand called, a line called Pelle di Giovane, which is excellent. Use something strong, that'll clean out your pores.
Another thing you've also said, I remember the last time you were here talking about exfoliating. It's important to exfoliate, and that helps keep the skin clean.
Yeah, and you want to exfoliate, but you don't want to use a rubbing exfoliator because there's, again, you're going to release more oils. You want to use a chemical like a salicylic acid that penetrates down into your skin, cleans out your pores. And then when it comes to moisturizers, most moisturizers are going to completely block your pores and just completely reverse everything you just did by cleansing and exfoliating. You want to be very careful. There's only a couple of moisturizers that I recommend. We'll have those listed on the website for acne-prone skin. Okay,
you mentioned the website. I'm going to tell people, go to our website because we've got a bunch more tips, even things like changing your sheets and how to wear your hair, on ways to avoid getting acne. Those are some of the ways people, when they're adults, get acne.
Right.
But they're also, it can have to do with hormones as you get older.
I think that a lot of women especially notice this and think this, that their hormones are causing their acne, and they'll go talk to their doctor about it, and the doctor will say, no, it's something else. But hormones play a huge role when it comes to acne. Especially as women age, their progesterone levels drop. Progesterone has a very huge effect on protecting your skin. If you don't have enough progesterone, you're going to break out. That's why women break out more so at the end of their menstrual cycle. They notice that they get these deep cystic zits. That's because progesterone's low. We can actually test hormones now. I typically use saliva to test hormones, balance hormones, and by balancing hormones makes a big difference in terms of helping clear up a face. A lot of women make too much testosterone. People think of it as a male hormone, but women make testosterone too. A lot of women out there have high testosterone levels. We can find that through the saliva, give a medicine to help bring the testosterone level down, and that will help clear up a face.
The way to treat it is not necessarily just by putting stuff on the skin, but by sometimes what's inside your body.
You got to fix what's going on the inside. You got to fix what's going on the outside. And we're having a hormone conference tonight down at the Draper Library where we're going to talk all about hormone balancing, not only from an acne standpoint, but on a woman wellness, menopause, premenopausal standpoint as well. 7 o'clock, Draper City Library.
Yeah, because I know that a few things you've said, people, their ears have perked up. So if they want to know more, go to the Draper Library tonight.
Yep.
And it's pretty full already, but you'll find places for people.
We'll fit people in tonight. So we're talking about hormones tonight, but then website, your website,
go to our
website.
Yeah. So if people want more information, go to our website, studio5.ksl.com. We've got all the information and more. And they can also go to your website, utahLaserMD.com, right?
Or call our office 281-0022 for more information about any of this.
Yeah, you don't have to have zits when you get older.
We can fix it.
That's all remediable. Okay, thanks for stopping in.
It's great to be here. We'll
have healthier skin now. You're going to take a break right now. Don't go away. Amanda I. Coming right back. A little bit more right here on Studio 5. Brooke, wouldn't it be great to take 15 years off your appearance? 15 years without even having to go under the knife. Dr. Jepson with the Utah Dermatologic and Medical Procedure Clinic is here to tell us it can be done, right?
Absolutely can be done.
Most people would think you have to have a facelift, you're going to be cutting, you're going to be sewing, you're going to be doing stuff. You don't.